Earlier this year, I had the pleasure of interviewing some 15 plus healthcare business leaders, from researchers to practice owners to people in health tech. And it was really, really enlightening for me as someone who has a healthcare marketing and AI agency to help me with the work that I do with my own clients. So the idea is that I wanted to put everything together into a research paper, and this is the video that quickly walks through it. So I hope there will be some useful things for you. And if you're watching and you did one of the interviews, thank you so much. I really did appreciate the time that you carved out in your busy calendars for me. So let's dive through. We have 5 key things that will be takeaways for you, and then a quick 3 questions that will be helpful for you in hopefully helping shape your own marketing. So 5 quick things, and I'll try and keep this video nice and short, but I'll put the link to the whole document underneath. So first of all, it's about showing your professional reasoning over just showing your authentic personality. And I call it your professional personality. So for example, if you're someone who does cosmetic treatments and you're someone who really values doing your treatments in a way that enhances the natural beauty, for example, that's already there, then let people know in the content, in the marketing materials that you have. Whereas if you're someone who values different things, like a complete transformation makeover, for example, then let them know that. And it's a surefire way to get your ideal customers, clients, patients, because people want to work with people who have alignment in terms of values. So that's the first one. The second one is about demonstration compared to declaration. So one amazing way to build trust is to show the work that you do. And really, this is the same reason why gyms allow you to come and have a trial week or a trial session, so that you can experience through demonstration how great the gym is before you have to sign up. And that's much more powerful than just seeing 100 testimonials about how great the gym is. And this was actually got from a medical device company who found that when they brought clinicians in to actually experience or use the products, then their conversion rates massively increased. The third one is about being personal with your results and not presuming that there's a one size fits all. So I think often in marketing, people try to present an end result, and that's a great idea. However, if you're not careful, people feel like, well, that's not for me. Maybe I won't get that result. And it's because the route to getting those results are very different. So the example I gave is that for me, if I was to look for a personal trainer, second gym reference, probably making me think that I should go to the gym, I don't necessarily want someone who's promising that I'll look like their fittest client in 3 months. I want to see how they're going to adapt their approach to me so that I can feel full of trust that they will be able to get me great results. The fourth one is about innovation. We know that in healthcare, there's a lot of compliance, and it can be a tricky place to navigate when innovation comes in. So what we found was that presenting innovation as an addition, as opposed to something that's a complete overhaul, which is often something seen as more risky and something easier to shun and turn away from, is a far better way of doing it. And I would essentially say to you that, let's say you have patients, for example, or if you're working with clinicians who need to change their approach, it's better to, well, I actually gave an example. I said it's a bit like introducing a new app to my parents. If I frame it that this replaces everything you know, then they'll probably resist. But if I say, oh, it's a bit like Google, but you can actually speak directly to it, then it all makes sense to them. And then the fifth one is about quality targeting. And really, it's all part of this central theme. And that is that people think that quality targeting means focusing on a certain person aged, or a gender, for example, aged between 35 and 45. But in reality, it's about focusing on what they think and where they are and how they believe different things and how they approach things. That allows your ideal audience to chime with you in a much better way. So let's move on to the 3 questions that you can ask yourself to help tell your unique story. So one is, instead of thinking about what's your unique selling proposition, ask yourself, what do you believe about your field that others don't? Instead of saying who's your target audience, think who benefits most from the way that I do things. And instead of thinking what's my brand message, ask a colleague about how you approach your work differently. I hope this helps. Read the article below. All the best.